Imagine climbing a single flight of stairs. Halfway up, your chest suddenly tightens, and every breath becomes a struggle. You try to take a deep breath, but it feels as though you're trying to breathe through a tiny straw. A wheezing sound begins. You cough, but the tightness doesn't go away. For a moment, every breath feels like hard work. For millions of people around the world living with asthma, this can be a frightening reality. The good news is that asthma doesn't have to control your life. With the right treatment, proper inhaler technique, regular medical care, and healthy daily habits, many people with asthma live active, healthy, and fulfilling lives. According to the World Health Organization, asthma affects an estimated 260 million people worldwide, and remains one of the most common chronic diseases affecting both children and adults. In this complete guide, you'll learn what asthma is, what causes it, why inhalers are so important, and what scientific research says about natural ways to support healthy lungs. It's important to remember that while healthy lifestyle habits can support lung health, they do not replace prescribed asthma medication. Stay with us until the end, because one simple inhaler technique, often overlooked even by people who have used inhalers for years, can make a significant difference in how much medication actually reaches your lungs. Let's begin. What is asthma? Asthma is a long-term condition that affects the airways, the small tubes that carry air in and out of your lungs. When asthma is well controlled, these airways remain open, allowing air to move freely. But during an asthma flare-up, 3 changes occur inside the airways that make breathing much more difficult. First, the lining of the airways becomes inflamed and swollen. Second, the muscles surrounding the airways tighten, narrowing the breathing passages. Third, the airways often produce extra mucus, further reducing the space through which air can move. Together, these changes make it harder for air to flow into and out of the lungs. As a result, people with asthma may experience wheezing, persistent coughing, chest tightness, shortness of breath. Symptoms vary widely from person to person. Some people experience only occasional mild symptoms, while others have frequent flare-ups or severe asthma attacks that require urgent medical attention. Learning to recognize your early warning signs and following your asthma action plan if you have one can help prevent symptoms from becoming more severe. What causes asthma? Asthma is caused by inflammation and narrowing of the airways, often triggered by allergies, dust, smoke, cold air, mold, or respiratory infections. Why inhalers are so important? Inhalers are the cornerstone of asthma treatment because they deliver medicine directly to the lungs, helping to quickly relieve symptoms and reduce inflammation. What scientific research says about natural ways to support healthy lungs? Research suggests that regular exercise, avoiding triggers, and not smoking can support overall lung health. Here are a few natural remedies that have been studied for asthma or respiratory health. None of them should replace prescribed asthma medication, but some may help with certain symptoms. Some evidence: honey may soothe cough and throat irritation but does not treat asthma itself. Ginger. Some laboratory studies suggest it may have anti-inflammatory and mild bronchodilating effects. Turmeric, curcumin, has anti-inflammatory properties. If you found this guide helpful, consider sharing it with someone who lives with asthma. The right information could help them recognize warning signs earlier, use their medication more effectively, and better manage their condition. If you have asthma, remember that regular medical care, correct inhaler technique, and following your prescribed treatment plan are the keys to keeping symptoms under control. Thanks for watching, and I will see you in the next video.